I'm Jim Masterson, and I am a urologist. I went to the Naval Academy and graduated in '96 with an electrical engineering degree and had not planned at that time to become a urologist. I flew transport helicopters for several years before going back to school, medical school, to become a physician. I went to the Uniformed Service University, which is located just outside of NIH. It's a military medical school in the sense that you owe 7 years after you graduate to the military, but it's structured exactly the same as any other medical school. And from there, I did my internship at Walter Reed. I went into medical school not planning to become a urologist, but I did a rotation on urology. And during that rotation, I realized we were easily able to radically change these patients' lives, and they were very happy. And we also get a chance, oftentimes, unlike other surgical procedures, where you develop a lifelong relationship with the patient. Oftentimes, the treatments that we provide, we have to keep close contact with the patients, and I enjoy having a relationship with a patient over years in many cases. It's such a good feeling when I have a patient that I've treated and I've followed them along and they have such a great outcome. My patient care philosophy is I would like to treat the patients as I would treat my own family. I recognize that a patient is part of the treatment team. So it's not always what my family would want or what I would want, but I need to make sure the patient is educated on what their condition is, what happens if we do or do not do a certain procedure or use a certain medication. I've had several patients that were not good surgical candidates. They could barely walk 100 yards without feeling short of breath, and they would have difficulty urinating, requiring a permanent catheter. And so they would come see me to see what their options were. And so we've come together and develop a plan, and I'll do a surgical procedure depending on the patient. And then when they remove the catheter and they're able to urinate very easily without leakage, those patients are so happy after being with a catheter for months or even a year or more, and now they're free. And it's such a good feeling to help a patient out. I live in Annapolis, about 1.5 miles away from my office, and it is great. And I'm one of the few physicians, I think, that I don't mind seeing my patients out in town. I enjoy where I live and where I work.